This is Ms. Remy in the Future Center. I'm here with Amanda Roper from Centura Health. Amanda's here to talk a little bit about some of the apprenticeships offered through Centura Health. So thank you for coming, Amanda. And can you please tell us a little bit about your organization and the apprenticeship that you offer?
Thanks for having me. I am our talent partnership consultant at Centura Health. So that means that I get to work on all of our different training and education programs and bringing in new programs and new students into those programs. We work on a ton of different apprenticeship programs and training programs, but Centura Health as a whole is the largest healthcare provider in the state of Colorado. We have 17 hospitals and 10 standalone clinics. So when you go see, your regular doctor, we operate those clinics. We also operate Flight for Life Colorado. At Centura Health, we are very adamant about giving our employees the room for growth and opportunity. So if you become a Centura Health employee, just know that we're here to support you. And we're always ready to help you along in your next step. As an organization, we provide tuition reimbursement for our associates. So that means, if you become an employee, whether it's part-time or full-time, we're going to help support you in your tuition to continue to learn and grow into whatever field you choose. So something that we really pride ourselves on. But some of these programs that are really great for students that are just finishing up high school, really want to get into healthcare, maybe not super sure where they want to land. That's where that apprenticeship model comes in, and it is just so helpful. So we have apprenticeship programs in sterile processing, medical assisting, pharmacy tech, surgical tech, and medical lab tech. Long list, so I forget them sometimes. And what an apprenticeship program means is that you're able to do all of your education and your on-the-job training at the same time. Whereas in a traditional healthcare model, you would go do all of your education first, and then you would do what we call clinicals after you've completed your education. Typically, clinicals are unpaid, whereas with the apprenticeship program, you are paid for all of those hours that you're in there working. So it's really great, and it's a livable wage that you're making right off the bat. And then because it's a registered apprenticeship program, we have what they call an incremental increase, my apologies. And that means that when you've gotten about halfway through the program and you've achieved about half the competencies in the program, you're going to get a pay increase. And then at the end of the program, once you become certified, you're going to get another pay increase. So it's a really great setup for people who want to kind of get their foot in the door. And then with all of those positions, we've also defined some great career ladders, whether they're upward movement or lateral movement. So definitely something to always look into and explore.
So I know most of our students are going to be familiar with like pharmacy tech or medical assisting. I think there's a little bit less familiarity with things like sterile processing tech, lab tech. Can you give us some insight into what those jobs look like for students?
Definitely. So a sterile processing tech, we always refer to them as the backbone of a hospital. In sterile processing, they're the ones who take any equipment that has been used on a patient in the hospital, whether it's surgical equipment, sometimes thinking about things like ventilators, equipment from there. They're going to take them into the sterile processing department, and they're going to clean and sanitize and sterilize all of that equipment for future use on a patient. I don't know if anyone's a little naive like I was. I just kind of assumed that every time somebody got equipment, it was brand new. But in hindsight, that would be very wasteful and very expensive. So they have different equipment that they use, different chemicals that they use. And the intent is to prevent infection from many patients. We always want patients to leave healthier than when they came in. And if we aren't making sure that all of that equipment is clean and sterilized, we're not giving them that opportunity. So they really are a vital role to the health and safety of all of our patients. And then a medical lab tech, obviously they work in the lab and they take specimens. They're analyzing the specimens, trying to read and understand. So if you have maybe a biopsy on something, they're going to look at it and they're going to try to understand, is it cancerous? Is it something that we need to be concerned about? So they're going to make that slide that you guys might be doing in science class, and they're going to be looking in the microscope at that slide, trying to understand what may be going on.
And so are there any requirements for these apprenticeships to apply for them? Are you looking for any specific training for students who are going into these apprenticeships?
Yeah, so our medical assisting, sterile processing, and pharmacy tech apprenticeships are 100% entry level. The only requirement is a high school diploma or GED. And for those, if you were to create your resume because you were applying to one of those positions, you would just want to go through your skills and see how they lend themselves to healthcare. Maybe you have a background in babysitting. Well, that shows that you're able to care for other people. So that's something that you would want to highlight in your resume. So those are great, completely entry level, and the courses related are taken at a couple of our local community colleges. With our surgical tech and medical lab tech programs, those have prerequisites. So medical lab tech has 2 semesters of prereqs. It's a lot of your general ed courses at the community college, and then some more dedicated science courses, things like biology. And then with surgical tech, we actually, the way that program works is we hire the students that are in their final semester of a formal surgical tech program. In that semester, they would be going out to a local hospital to complete their case requirements. So we hire them as apprentices, and then rather than working full-time, unpaid, completing those cases like the traditional model, we're able to pay them for that entire semester of doing those cases. So that's 3 semesters of school, and then we hire in the 4th and final semester.
So for the other apprenticeships, what are the time commitments?
Yeah, so we typically, depending on the program, medical assisting and pharmacy tech, we require a minimum of 12 to 16 hours a week working. Sterile processing is actually a full-time job, so that one looks a little bit different. And then we've worked with our community college partners, so your in-person lab lecture days are once a week. We know it would be really difficult for people to be commuting to and from work and then to and from a campus multiple times a week. So it's one day spent on campus, usually kind of a 9 to 4, 9 to 5 setup where you're doing in-person lab lecture. For most of our programs, that's on Friday. And then for sterile processing, we actually do that one on Sunday because we aren't typically doing surgical cases in our hospitals on Sundays unless they're emergency. So overall, if you roll in the amount of hours that are required, the in-person lab lecture days, and then the recommended study and homework time, you're looking at anywhere from 30 to 60 hours a week, depending on the program.
All right. What is the salary range over the course of the apprenticeship?
Yeah, so all of our apprenticeship programs, with the exception of medical lab tech and surgical tech, because those ones require a little bit more experience, they all start at around $15 an hour. Most of them have gotten a pay increase recently, so that's a plus. Unfortunately, I can't remember what they are off the top of my head. And then by the time the programs are completed, depending on the program, you're making anywhere from 17 to 20, just over $20 an hour.
Is there any cost for students to participate in the apprenticeship that must be paid out of pocket?
Yeah, so for each program, Centura Health is committed to having students not come out of the programs with an incredible amount of debt. So we've worked with community colleges to make sure that all of those program costs are really manageable, and we contribute tuition for each apprentice. So for medical assisting, we contribute $2,500 towards tuition, and then for pharmacy tech, medical lab tech, and sterile processing tech, we do $3,000, and each program is just over a semester in length, 6 months long. And we also direct apprentices to partner with the local workforce center, depending on the county that you live in. And there's so much grant funding out there right now that most of our apprentices pay little to nothing out of pocket. With our tuition contribution, there is a payback agreement. So that means that when you accept that money, you're agreeing to work with us for 12 or 13 months, depending on the program, once you've become certified. And that's just you reinvesting back in Centura after we've invested in you. But overall little to nothing out of pocket. And the overall tuition cost ranges anywhere from $4,500 to about $6,000, depending on the program.
You mentioned the 12 to 13 months that you would need to work for Centura after the program. After that point, are students free to continue working for Centura? Do they typically continue in their same position, or does that contract end?
Nope, it's not. The way that it's written out, it's not a contract in that your employment ends at that point. We want you to stay. We want you to stay forever if you can and continue to learn and grow with Centura Health. So once that 12 to 13 months is up, it just means that if you were to depart, you wouldn't owe any of that money back that we contributed.
Okay. When does the next training cohort take place?
Excellent timing. Our application app actually opens up on Monday, May 3rd. So here in just a few days. We'll be interviewing and reviewing applications over the summer, and then the academic start date is August 23rd for our programs, and the employment start date is September 13th.
And so what is the application process for students who'd like to apply?
Yeah, so the job postings will be posted on our careers page. We also share out flyers and information sessions. So students can jump on a little webinar that just goes through all of our different programs, kind of those little odds and ends that people have questions about. And then you can apply to whichever program you're interested in. And from there, your application goes through a recruiter, and that recruiter is going to review your application to make sure that you meet the minimum requirements. And then the recruiter is going to send you some screening questions. Sometimes they're able to do it by phone, sometimes it's via email, but they're using those questions to determine your fit for the program and also to determine your dedication. So if you were to receive your screening questions from a recruiter on Monday morning and it took you 2 weeks to respond, that might in our eyes make you not the greatest candidate. So it's one of those things where we're already kind of putting you in the interview process by seeing, you know, are you on top of things? Are you ready to jump in? Are you committed to getting back to us? And then after they receive the screening questions, they're going to go through, determine whether or not you'd be a good fit for the program. And if they do feel that you're a good fit, they're going to put you over in touch with the hiring manager. We have our hiring managers at our different facilities, different clinics, different pharmacies, whatever the program may be, interview each of the candidates that would be a possibility for their site. We always want to make sure it's a good fit for the site and for the apprentice. You're interviewing them as well. And then if the hiring manager thinks you'd be a good fit, they're going to let us know that we're okay to send you a verbal offer. And so what that would do is get you in touch with a recruiter. They'd let you know that we intend to extend a formal offer. If you accept that verbal offer, we're going to start all of the fun human resources stuff on the background or in the background. So things like a background check, which you do need to be able to pass. That background check also includes a drug and health screen. For some of the positions, there are things like a minimum lifting requirement of maybe 20, 30 pounds. So that's kind of where that health screen stuff comes in. And then as a healthcare employee, you are required to have a handful of various vaccinations. Most of those vaccinations are things that are required for you guys to be in school. So nothing crazy, nothing new there. And then you're going to get your formal offer. You're going to get put in touch with Workforce. Workforce is going to start working with you on your tuition assistance if they're able to provide it, as well as their wraparound services. And the community college is going to reach out to you and they're going to help you get enrolled in the college and in the right classes. So you don't need to apply to the college beforehand. We'll help you with that entire process. And then once you're selected, you don't have to register for any classes. The college will actually go in and do it for you. So it's a really great partnership where you're really guided along the way. Nobody is kind of left to figure out what's next.
Wonderful. Thank you so much. Is there anything else you'd like to add, or that's all my questions? So.
Yeah, I just want to remind everybody that, when you're done with school, regardless of what you're going into, if you are deciding to continue your education, always look into any sort of funding support that you can find. There's so much out there aside from student loans that we always encourage people to look into. And if you are interested in healthcare, apprenticeship and training programs are a great place to start. It really allows you to get your foot in the door, help you understand, what you like, what you don't like, and maybe you start out as a medical assistant and you realize that's a little bit too much patient facing time, so that we can help you find a different role where you're still able to be in healthcare, but maybe with a little less patient facing time. So know that there are so many options out there in healthcare. It's not just doctors and nurses and 8 to 15 years of school. So we have resources that I'll share with Victoria to direct you guys to our website, where there's just a ton of information about our different positions and apprenticeship and training programs that you guys should definitely check out.
Great. Thank you so much.